I wanted to welcome all of you to this session on health and medicine. My name is Liz Randolph, and my colleague Diana Jellica and I are going to be co-hosting this session, and Jonathan Weinstein will be your moderator in a sense. Before we start, I just have a few housekeeping announcements to impart. So this session is going to run until 2:45, and there'll be a 30-minute, actually, we're not going to a second break. If you have any questions along the way, just raise your hand. We'll be using the chat feature and the raise hand feature for questions during the program, and you can always also just feel free to raise your hand and just ask your questions out loud. Just feel free to jump in. Just be sure to if you raise your hand, to just lower it after you're done, after your question's been answered. From 4:40 to 5 p.m., we're going to have the opportunity to go into breakout sessions, which will give you a bit of a more intimate time to speak with the mentors. And we'll say more about how this is going to work later. But for now, I'm just going to turn it over to our anchor mentor, Jonathan Weinstein, and we'll go from there.
Thank you, Elizabeth. All right, so my name is Jonathan Weinstein. I graduated with the class of '96. I live in Scarsdale in New York, and I work for the VA, which is a Veterans Administration hospital in Montrose, New York, which is just above the Croton Harmon train stop, for those of you who take the Green Line. And I am a clinical psychologist, and I am in the role of suicide prevention, which means I do a number of different things, some that are public health related, some that are clinical services, mental health services, psychotherapy services related, some that are training related, some that are systems and organization related, revolving chasing after high-risk patients and developing systems of care. I do some outreach. So there's a wide range of clinical and administrative activities. I do a little bit of writing and research. I've co-authored 2 books on how to implement social emotional learning into classroom environments to empower students that I've written with my wife, who's an English teacher, or was one anyway. Now she's written about 5 books. And I do a little bit of academic writing in my field of suicide prevention. So that's some of the things I'm involved with. If you want to follow me on Twitter, I'm at JH Weinstein. That's a good way to see what I'm following and researching and talking about. Yeah, that's about it. I will pass it off to Alexis to tell us all what she's been up to. Go ahead.
Hi all, thank you, Jonathan. Thank you all for being here. It's really nice to see all your faces, and it's really admirable that you actually are doing this as sophomores. I never would have in your shoes. So I am a plastic surgeon. I live in Brooklyn, and I am not a Vassar alum. I went to Brown, but my kid is a freshman at Vassar. And I didn't, my path to medicine was pretty circuitous. I started out as a history major. I was very interested in also studio art. I took a bunch of classes at RISD and at Brown. And then when I graduated, I was like, I guess I gotta get a job. I literally had no idea what I was gonna do. I had thought about doing pre-med and medicine, but I was very intimidated by the classes, and I just kept on thinking I couldn't do it, so I didn't do it. And when I graduated, I worked for the New York City Department of Health and Age Education. That it was '87, and it was really a huge public health problem and very little education about it. So I worked with IV drug users in an outreach program. I kept on thinking I was interested in medicine, so I did some volunteer work at Downstate Hospital, which is a public hospital in Brooklyn. and I worked with teen pregnancy program and pediatric play therapy, and then started thinking maybe I was really sort of gonna be interested in medicine. But then I took another road and ended up going into the Peace Corps and was in Honduras. I worked in the health sector there for 2 years, and in a very, very poor rural town, no electricity, no running water, and worked with a local health center, collaborating with the nurse there, and did a lot of hands-on things, and learned that that really solidified my interest in medicine. So I ended up going to Bryn Mawr. I did a post-bac pre-med program there, which was a year and 2 summers. You know, to my surprise, I mean, I really went into it saying, well, I'll probably fail, but, you know, but I didn't, and I did very well. And then I went to med school back at Brown, and then ended up doing a surgery residency and microsurgery, plastic surgery at NYU. The beginning of my career, I worked mostly at Bellevue, which is a trauma center, and the VA, the Manhattan VA, connected to NYU, and did a lot of like limb reattachment and very sort of complicated trauma cases. And then as I got older, that wasn't as appealing, the late nights and the emergency aspect of it. So I started doing more and more breast reconstruction. And now my practice has evolved. I'm in private practice. I'm still affiliated with NYU. I have always done some research and writing, medical writing, and I continue to do that. But now my focus is more on transgender surgery and transgender population. And I continue to be involved with NYU, but I have a little more freedom as to my time. And that's my story. Nice to see you all. I'm happy to be here. And I guess I'm passing it on to John.
Hello, everybody. I guess it's my turn. Name is John Capitoro. I'm a physician, class of 81. I was a biochemistry major, did my pre-med classes there at Vassar, and then went to medical school in Italy, where I spent the next 6 years getting my medical training, and after which I came back to the United States and did my internal medicine, my medical training in internal medicine and pediatrics. It was a med-peds program, which combined the two specialties, and I was able to do both in 4 years. And then after that, did my additional subspecialty training in endocrinology, which was a 3-year program up in Boston, where I did both adult and pediatric endocrinology. After which I joined a practice mostly focusing on adult and pediatric endocrinology and diabetology. Obviously, a lot of patients with diabetes that had, as one of the complications of diabetes, had these chronic wounds that, you know, unfortunately at the time, and I'm talking about 20 years ago, there was little that was being done for these people. You know, they were being seen by an endocrinologist who had very little surgical experience, or podiatrists that, you know, would deal with these wounds. So I saw that there was a need out there. So I realized that, you know, working with hospitals, you know, I wanted to be able to develop this network of wound care centers throughout the country, and be able to focus and deal with these patients. So I kind of shifted over to the administrative and entrepreneurial side of medicine, where I partnered up with these hospitals to open up these wound care centers. And to do so, I had to get additional business school training. I went back to business school and got business school training. And you know, it's been 20 years now that I've been working with this wound care management company as the chief medical officer. So I think, as Alexis and Jonathan have mentioned, you know, your path is not going to be linear. You know, it's going to be circuitous, and your ability to adapt and change and find what you're interested in and get that additional training is something that's going to be ongoing, you know, throughout your life. So don't feel overwhelmed when you look at, you know, what do I want to do for the rest of my life? Well, it's not something that you should decide at this point, but work on it. You know, obviously don't be overwhelmed. It's a long road, but it's definitely something that I would do again if I had to. So that's pretty much where I am today. So I'm going to pass it on to Sanjita. Did I say that right?
Yes, you did.
Good.
Hi, everyone. Thank you all for joining in. So I'm a med student right now. I graduated from Vassar in 2017. My major was biology. I was pre-med, and then I minored in sociology as well. So after graduation, I wasn't too sure about medicine, so I wanted to have that hospital setting experience more. I did volunteer one of my summers in a hospital, but I wanted to solidify my interest in medicine. So I went ahead and worked at Dana-Farber Cancer Institute in Boston, where I was the clinical research coordinator. I would interview patients about a health literacy project that I was on. It was a very good experience for me because that interaction with patients, I enjoyed a lot. And I did that for 2 years, and that sort of solidified my interest in medicine. And I decided to apply to medical school. I felt I was ready. And now I'm in med school. As John and Alexis, they said, it's for a lot of students, it won't be a linear path, and that is okay. As sophomores, I was very confused as a sophomore. I didn't know if I wanted to biology. If I had gone back, I would have taken more diverse classes as a student, because I realized later on that I'm extremely interested in sociology, but by the time I realized that, it was junior year, and at that time I could only minor in it. So keep your options open and try and explore different fields, because even like there's no age for education. That's what I believe in. So even if later on you find out that the field that you're in, you're not interested in, you can always take a step back and do something else. So yeah, don't feel like you have to pigeonhole yourself, you know? So that's me. I will pass it on to Lauren.
Thanks. Hi, everyone. I'm Lauren Scheiman. I graduated from Vassar in 2010. I was a math major and dance minor, and also pre-med. I currently work for the New York City Department of Health and Mental Hygiene. I am the Director of Research and Evaluation for the Bronx. I'm an epidemiologist, which normally I explain what that is, but in the age of COVID, I think finally everybody knows. So that's very exciting. Similar to Sanjita, actually, I also right after Vassar worked at Dana-Farber Cancer Center. Thought I wanted to go to medical school. It's a fantastic institution, and I had the opposite feeling. I absolutely hated my day-to-day job. I couldn't believe this was the life I was signing up for, but it was really helpful to me because I didn't go to medical school. I met with a lot of alumni, Vassar alumni, and other professionals who were kind enough to give time to talk to me about their work. And at some point, somebody said to me, you're really talking about public health. not medicine. And I didn't know what public health was. So I Googled it. Turned out that is what I was talking about. And I absolutely love public health. When I found it, I really found a religion. It just really resonated for me. So want to echo what she said about getting out there and getting experience and trying different things. I never would have known otherwise that I was kind of headed down a path that wasn't right for me. So I'm happy to talk more about my current work. So just to say, I typically work on long-term structural issues that affect health of people in the Bronx. So things like housing policy, food availability, education, structural racism. And since March of 2020, I have been activated into an emergency role to work exclusively on COVID. So that's been a pretty wild ride, and I'm happy to talk more about that if folks are interested in that as well. And I'll pass it off to Morgan.
Good afternoon, everyone. My name is Morgan Mako. I am a member of the class of 2011. I am currently a family nurse practitioner and HIV specialist. I am also a member of the National Health Service Corps. I specialize in the areas of LGBTQI+ medicine. I treat HIV and hepatitis C, and I also specialize in the treatment of what we refer to as office-based treatment of opioid addiction, or medication-assisted therapy with things like Suboxone, Vivitrol, and buprenorphine, and naloxone for people with various types of substance use disorders involving opioids. I currently work in a community health center north of Boston in a town called Lynn, which has the highest, or at one point did have the highest COVID infection rate. And so, you know, my world has been very intimately involved in this kind of work, and also recently having COVID myself, but doing well. If anyone wants to talk about vaccines or things later on, happy to talk about that too. But I actually started school as a religion major, and I became interested in sort of cross-cultural different perspectives. Earlier I used the word erroneously alternative. I like more just simply different ways of viewing health and wellness, disease and suffering, and sort of how that led me into the world of health and medicine. I started pre-med as well, but I found that it's very difficult to focus on what I wanted to study the most when I was at Vassar, plus I was on the crew team. And so I completed a post-baccalaureate pre-med program, but having grown up around nursing, my mother being a nurse, I ended up deciding to become a nurse practitioner. And so I then also completed a fellowship program in family medicine, community health in the Bronx through the Institute of Family Health. And then as a member of the National Service Corps, I located work in Lynn, north of Boston. And so, some of the things I talked about earlier, which may or may not be relevant in this, discussion this afternoon, is just sort of the skills that you can hone regardless of your major. Whether it's your writing ability, research ability, communication, and just sort of also overcoming barriers to various types of medical education or careers in medicine, nursing, healthcare. And, I think those are kind of the two main things that we focused on, but ultimately I'd like to know what everyone's interested in this session as well. So I hope that's helpful.
You're on mute.
I knew that would happen at least once.
Did you hear anything that I said?
Yeah, I heard everything.
Okay, good.
Yeah. I was the one on mute.
Okay.
So there's a good bit more of us, and I want to invite people to raise their hands or write in the chat when questions come to your mind. if you are hearing things that are causing you to have a strong reaction, that's probably interesting. I would encourage you to share that, whatever, even if you don't quite understand it, but that could be potentially useful for you. I suppose I could start with a question and give you all more time to think about what you might want to ask any of us. This time, I guess my question is going to be more oriented towards like a work-life balance type question. I've often found it the case that one way I have been successful at managing the things that I feel overwhelmed and burnt out with is by pursuing opportunities to grow professionally and to, you know, develop my career. And I've often found that if I'm burning out, it's probably because I'm not taking that next step to grow. And so what I'd be interested to hear about from the panel is what ways you have managed to grow in your professional development, in your career, and in your, you know, relationships with your colleagues and your community. What has worked for you to keep you coming back to work every day? Whoever wants to go.
I'd also like to offer, if anyone's interested in the flip side of what has led you to leave a position, which I think actually in one of the sessions earlier in the week, students were very interested in knowing sort of the experiences of turning down a position, how to leave a position, and sort of the process of how to decide that. So,
yeah, good stuff.
I think, you know, Morgan, your question. I was part of a practice when I first finished my training and my subspecialty in endocrinology. I joined this practice on Staten Island, New York, and I found, you know, for 7 years during that time, I found myself to be maybe the word burnout was kind of premature, you know, since I had just started practice. But at the same time, I wasn't getting the motivation, you know, the feeling that I was where I needed to be. So, you know, it was a moment which was very difficult because I had to decide what I wanted to do, which direction I was going to go. I had a family, I had my wife, I had a young child, and here I was leaving a practice which was providing me with a good salary and a good living, but not making me happy. So you know, you get to the point where with the support of that family, you know, I was willing to take a step laterally and try something else. And it's not an easy decision to make, but I think it's part of, I guess, you know, what I learned at Vassar is you got to find what you are happy doing, and like I said from the very beginning, it's going to be circuitous. It's not going to be a straight line. So you got to be willing, you know, to move one way or the other. When you get to those forks in the road, you have to be able to evaluate where you are and where you want to be. And you know, there are times where you'll just, you know, take a pass and say, I'm happy where I am. But there are others where you say, I'm not where I need to be, and I'm going to take this other road and let's see where it takes me. As far as, you know, work-life balance, Jonathan, I think I told one of the students in the chat room the prior call, it's important every once in a while to take some time off. It's important every once in a while to, you know, take a vacation. You know, it's important every once in a while to be able to say no as they pile on more and more work onto your desk, onto your plate. And I think there's no better feeling than when you come back from that time off, whether it's a vacation, whether it's a day from work, and no better feeling than when you come back to work and you have that energy again, and you recharge your batteries. So it's important that you pause every once in a while, reflect, and recharge your batteries.
I can go now.
Benji?
I
Alexis, yes.
totally agree with what everyone's been saying. I think for me, there has not been a work-life balance, and it's been really challenging to find it. So the only way I can do it is by blocking out time, like John was talking about, and taking that time off. And it's kind of like finals. You can get through finals if you know that at the end of finals, there's going to be a break. But if every week was finals, you would completely burn out. But I think in medicine, healthcare, direct patient care, especially if you're dealing with mental health issues, psychosocial issues, which all of us are to some degree or another, marginalized patients. It's very intense, it's very emotional, and it's exhausting. And you're dealing with real life stressors for people, and if you're an empathetic being, it's impossible not to sort of absorb some of that. So you have to figure out ways to take care of yourself, ways to recharge, ways to deflect. And I think the burnout is very, very real. And I have found that most organizations don't really care about you as a human being, and they don't really care about your wellness. And so you have to advocate for yourself. And you figure out what that means. And so for a lot of us, it means like having boundaries and saying, no, I can't take on that 100th project that you want me to take on with no extra pay and no time off. And it means recharging. So for me, there've been a lot of pivot points where I had to rethink things. And so that means time. It means time where you can reflect and not be burdened with everything. But one of the biggest turning points for me, which seems odd, was I partnered with a group of women surgeons, and we went to underserved countries where people had serious surgical issues that weren't being addressed, and went on missions and provided services for free. And so, I went to Bangladesh, I went to India, and those missions really recharged me, because it was like pure medicine. It was all my skills, everything I had learned. It was free. It was training other surgeons in those countries and taking care of people that would not have these operations were we not going. And it was also an opportunity to collaborate with women surgeons that were more senior to me, and then they became mentors to me. And all the things that I was going through in my career, they had been through, and they had figured out ways of managing and dealing. So I think, changing it up, and when you're not excited about what you're doing, you need to figure out ways of changing it. And sometimes it's a small change, like just leaving work a little bit earlier. But burnout is definitely real, and you have to sort of look out for it. And it's not just in medicine and health, but in all fields. So who hasn't spoken? Lauren.
I can chime in. I think too, it's really important to acknowledge, on the topic of work-life balance and burnout, I think for both clinical providers and public health professionals, this past year has been a really tough one. So the New York City Department of Health, like many local health departments, has an emergency structure that gets activated when there's a crisis. For example, I was activated for 4 weeks about 2 years ago when there was a measles outbreak in Brooklyn to kind of step away from my typical projects and typical role and work on the measles outbreak. I think that's a more sustainable, that's how the structure is supposed to work. I did it for 4 weeks. Somebody else cycled into my role and I went back to my day job. And that process went on for a few months and then the crisis, resolved. I think what's really challenging about COVID is that this is a marathon. It's not a 4-week shift. And it's not something where, people are cycling in and out of these emergency roles because everybody's really needed. It's really an all hands on deck situation. So at least for the New York City Health Department, and I think this is true a lot of places, all regular projects are on hold. The vital things that need to happen keep going, like folks who work on birth and death certificates are still doing their day job, but for the most part, we're all working on COVID. And in some respects, you could say folks doing death certificates are also working on COVID. And I think my sense from friends who are clinical providers is it's similar. People have been pulled away from their usual patient care to be rotated in some settings, depending on their skill set. And I think it's really important to say, in times like this, you feel like I have to just push through. Like burnout is real, but this is an emergency. That's why I went into this field, to be there for people. And it's even more important to take care of yourself in these times than it is in your regular day-to-day work. So, I've really pushed my team and I've tried to do it myself as well. Sometimes we have to work until 2 a.m. That's true, but then you should go for a long walk at lunch the next day. Sorry, I think you can hear my baby crying in the background. That is that's just life. And sometimes you need to sign off and have dinner with your family and come back to it. And I think it's really important to remember these things will be here tomorrow, especially with health crises. They aren't resolved in a day. And so when you have to step up and do something, you have to do it, but it's important to take care of yourself at the same time.
I would just add to that, in the age of telehealth, some of you might agree, I'm busier than ever. And, it's quite easy if you're working from home, since, we don't know what's going to happen in the future. I mean, many careers have already been, rerouted back into the home, and, it's very easy to work more than ever. But not necessarily be paid more, or find that benefit of being from home outweighs the impact, the negative impact it can have as well. Especially what if you don't have a workspace at home, or you've never worked remotely, or if you are like one of my colleagues who is a single mom with from Guatemala with 2 kids, and whose mom was on hospice at home with her when she got COVID. So this is an extraordinary time, full of stress. And, I think wellness and organizational support of its workers is essential now more than ever, and I definitely want to encourage that to be like a continued theme, no matter what you do and what jobs or things you consider in the future. Like for me, like salary is not the most important. I straight up ask, what kinds of things does this organization do to promote and take care of its workers? I'll just add one thing. I recently saw how, instead of measuring, the depression scores of patients in an organization, one organization started measuring the depression scores of its workers as an outcome metric, to incentivize sustainability and taking care of the workforce. Becoming a healthcare provider it's a sacrifice in a way that a lot of people, I think, underestimate. I underestimated. And so it's something that you don't really know until you try things out or get in there and experience it firsthand. But it's a big decision.
I would just like to add, it's very important to know yourself. So every day, just taking that time out, even if it's half an hour, to do something that gives you joy, whether it's running or meditation or dancing, especially during these times. It's just very important to just stop yourself, pause, and tell yourself that, okay, what can I do today that will give me joy apart from the 12 hours of studying that you have to do in medical school, or the 10 hours of work that you have to do. So just taking that time out for yourself, for your own mental health and well-being is very important. I try to do that every day just to keep my sanity intact.
If anyone's interested, oh, sorry.
No, go ahead. Norman.
I just recommend going to an organization called Thrive Global. It was founded by Ariana Huffington. And this organization really is all about, sustainability in the workforce, work environments, mindfulness, applications of neuroscience to productivity and satisfaction. Really at like the cutting edge of this whole thing that we're trying to get at. So I could put that in the chat box.
Great. At this point, I want to make sure we give students a chance to ask questions either in the chat or raise your hand. So if we're willing to tolerate a few moments of awkward silence, I want to at least make sure we hear from you. Daniel Lomi, did I say your name correctly?
Yeah, it's Lomi. Yeah.
Thank you.
My question was, what experiences, either at Vassar or undergrad, or later in your career, inspired you to like change career paths, or inspired you in a way that made you want to like change your focus of study?
Well, I can answer that for myself. I was working in law enforcement, and I was an investigator of city agencies in New York. And I ended up working in a housing project around all of these children who might have benefited from a mentor. And I really found myself wondering what would happen to all of them once I left that particular situation. And I guess you can call it a white saviorism or not, but I just felt like the path I was on wasn't the right one, and I needed to think about another way to interact with people in my world that felt a little bit more constructive. So that's, didn't happen right away, but I started going back to school, and I got a master's degree that allowed me in public administration, that allowed me to take psychology classes that I would need to apply successfully. So I think that was probably an important experience. I had volunteered at a crisis hotline, and I really valued that experience of talking to somebody on the other line without knowing what would happen to them, and trying to be a source of support, and making it an article of faith that just listening is meaningful. So that was definitely an awareness thing that I could do this. I could really live this way. I could live in service to others, and it would make a difference, and I would feel empowered by that. And then graduate school was, just crazy because so many challenges academically and personally and clinically just thrown at us before we really know how to make sense of any of it. I was attracted to doing work with children and in schools, and I wasn't very good at it for quite a while. And then I had an experience working in community mental health with folks who are suffering from addictions and traumas, and I was really good at that. Because a lot of those folks were similar to the people I worked with when I worked in law enforcement. So I sort of gravitated towards veterans as a result of that. And these are the things I absorbed in other experiences and I didn't even know that I had. So those are a few things that stand out in my mind right now as you ask that.
I think for me, I mentioned earlier that I worked at Dana-Farber Cancer Center right after Vassar. and I was working both in a research and a clinical setting. And I found myself asking really big picture questions about the things I was seeing. And looking back, I think that's a skill, probably the most important skill that I learned at Vassar is how to really think for yourself and how to look at things critically and not just accept sort of, I feel like people say so often, oh, that's just how it is. And at Vassar, I never heard that. Nobody ever said that at Vassar. At Vassar, it was like, well, why is it that way? Does it have to be that way? Is that the only way? And I found myself asking that a lot in a hospital setting of, if someone would come in who was uninsured and I think likely undocumented and be really far along in their disease and hadn't sought care in at a more appropriate time because they were scared to be in the system. And, people said like, this is just how it is working in a hospital. You're going to see cases like this. And I found myself saying like, no, does it have to be like this? Why is it like this? And I think that critical mindset is really what pushed me ultimately towards public health and towards not an individual patient setting, which is super important, but wasn't the right fit for me, but towards these big picture, what structural things can we change to give more people access to health, not just like the absence of disease or not just healthcare, but to healthier environments that they could live in, to healthier educational settings, to places that'll allow them to be their full selves and promote better mental health. I think Vassar really taught me to not just accept the system we have and to look at the things that I saw as problems and try to see yourself as part of that solution.
It's interesting that, Danielle, you asked the question, what classes or what events during my Vassar years helped me change my career path as opposed to push me down that career path. So, you're already, as a Vassar sophomore, already thinking about how to kind of maneuver your way through your career path. So that's very interesting. So I had to think about it because as I mentioned earlier, as a biochemistry major, if there's one regret I have about my Vassar experience was that if I had to do it all over again, I wouldn't pick biochemistry, not because it didn't help and give me the foundation to move forward. I enjoyed my studies there in biochemistry, but at the same time, it didn't allow me to explore other classes, other courses, because there were so many requirements to be a biochemistry major. But there were two classes, in particular that I took that gave me the encouraged me and gave me the feeling that I could do it. I could go into the business world, and I wasn't just a scientist, but I could also deal with business and deal with economics. I took two economics classes at Vassar, macro in particular, that I found, not only did I enjoy it, I excelled in it, I loved it, and never took another economics class again until I went to business school 20 years later. And again, it was those classes that I took at Vassar that gave me the confidence that I could go to business school, even as a doctor, because most doctors have the reputation of being horrible business people. I don't know, Alexis, I don't know if you have ever run into that attitude, but others that feel in our world we're not good business people. So you go in there. We talked about the imposter syndrome, thinking that I can't do this. There's no way I'm going to be able to go through business school. But those two classes that I took at Vassar in economics gave me that confidence. As simple-minded as that is, but to answer your question, yes, that there are everything that you're doing right now will help you down the line somewhere, somehow.
I don't think I figured it out, which not only which way not to go, but which way to go until much later. And I mean, now when I look back, I don't know what I was thinking about when I was in college, but I really wasn't thinking about a lifelong career per se. And yeah, I mean, it's kind of astounding to me now because I feel like in the end, I've been so directed. But I think it's really important to learn how to write in college and how to critically think. And though, as a history major, those were things that I did learn, and they helped me greatly, you know, going forward. And as a scientist, you know, you have to look at papers and see whether they're valid. And, you know, all that we're learning about COVID and the vaccine and all these, all this information, you know, how to critically analyze it is I think really the thing that you want, the basic thing you need to get out of college. If you can come out knowing what you want to do, that's amazing. But for a lot of us, that was not the case. And so the thing that really helped me figure out what I wanted to do in a very general way was being in the Peace Corps. And because I was working side by side with a nurse and seeing what delivering healthcare looked like. And, you know, obviously I'm in a completely different setting now. I'm in a major hospital, a tertiary care health center. But that was the thing that was the hands-on that really made me realize, okay, I could see myself doing this. I maybe could even be good at it. And then there was just the academic hurdle of getting through the classes. But I had some imaginings of what that potentially could look like. So for me, it happened much later. And, you know, for those of you who really don't know what you want to do, I think that is completely normal. And, you know, just keep an open mind and try and learn, you know, the skills of critical thinking and of learning how to condense information and how to write. And then, you know, you'll figure it out along the way. And it may be an aha moment, or it may be kind of a slow process. But really, you shouldn't be worried about it. I mean, I cannot stress that enough. I mean, for me, it was, you know, years after college. Did Morgan speak yet? Morgan?
I feel like I've spoken too much, but is there anything particular? I guess like what the concern about choosing what specifically and how to get there is that like what's the most?
If there was a moment when you realized in your studies, like, this is what I don't want to do, or this is the pivot point.
I knew I didn't want to go into academia in the sense that I didn't want to not work in a capacity that was not applied and not clinical as well. You know, if it was some sort of hybrid, fine. But, you know, I thought about going into just simply academia and academic research, which is obviously very important. But for me, I knew it would not be where my skill set would be used the most, or most gratifyingly so. And I remember, you know, I learned that through the process of writing a thesis, which I'm really glad that I did, because it opened, you know, it opened up my career actually, but it made me see that I didn't want to go into research academia or do a PhD, because that's not where my skill set lies. Not that that's not valuable.
For me, earlier on at Vassar, I realized I'm not good with numbers. So anything to do with math, no, it wasn't for me. I took economics as well. That didn't go that well. I was like, nope, that isn't for me as well. I realized clinical research isn't for me when I was working, because after a year and a half, I started asking myself, what is the next step? You know, like, I don't see myself as a clinical researcher anymore. What can I do next? I really enjoyed the patient interactions. I wanted to have that one-on-one experience with patients and be in the clinical aspect. So for me, I always had this in mind that I always thought that I was fit for medicine, but throughout Vassar, having volunteering in Bangladesh in a hospital setting, as well as in America in a hospital setting, that sort of started solidifying. And when I did clinical research for 2 years, I just knew that it wasn't something I wanted to pursue later on. So that's how I sort of used that way of eliminating what I do not like, and then come to what I actually think I will be good at doing in the future, or I will enjoy doing in the future.
Thank you.
All right. Are there other burning questions folks want to ask? Or if any of our panelists want to ask a question to one of our other panelists.
I'm just curious to know about what some of your experiences have been in, or frustrations of getting whatever it is you feel you need to prepare yourself or make decisions to enter, the health careers, especially at this time, being remote for most things, and sort of how is that innovatively being overcome would be just something I'd be curious to know. But that's my own curiosity, and I want you all to get the most out of this.
So that's more like your question to students. They're about their experience.
Mm-hmm.
Maybe as a follow-up to that, again, question to the students, what are you doing, given we're in the middle of a pandemic, what are you doing to set up, your summer internship, which is so important, because the common theme from all of us is not just what we like to do or finding out what we like to do, but also finding out what we don't want to do, right? And the only way you're going to find that out is if you go out there and explore, and internships. Summer internships are so important with that, right? Shadowing, realizing, I knew right away I definitely didn't want to do bench research. So I wanted more of the clinical aspect. And the only way to do that is through the internships. And I was just wondering, with the pandemic and obviously with the summer not looking too good as far as getting back to normal, what are you guys planning, if anything?
I see Emily Tincher raised her hand, so let's give her a chance to respond.
Sorry, I haven't used Zoom in a while. So internships is definitely tough right now, especially because like sophomores last year didn't get the opportunity to apply, and they're all juniors now. Just with more classes and a bit more experience, probably more opportunities they had at school. It's definitely tough for sophomores right now. But I actually wanted to ask if you guys have any advice on figuring out how to get like clinical volunteer hours, because that's like one non-essential things that I know a lot of hospitals have been cutting just because of COVID regulations, which is extremely understandable. But I know that it can be really helpful to figure out what you are interested in. So if anyone has any advice on that.
Yeah, I can answer that. When you turn 21, there's a great organization in New York City called Samaritans of New York. It's a crisis hotline has about 4 full-time employees and about 200 volunteers. And they offer you about 40 hours worth of training. And you work the lines. You do a couple, like maybe 2 shifts a month, including an overnight. So it's a great way to jump right in and decide if this might be something you want to try. Does help if you're, local to the city. And they always need volunteers, and that's where I got my start. And I know other grads have gotten their start there too in mental health. I'll put their link in the chat so you can track them down when the time comes. Other organizations run crisis hotlines and things like that need to be staffed. So those are, wherever you happen to be. Lots of health departments and hospitals have outreach programs. So those are possibilities. Oftentimes I see academics trying to hire or looking to hire, post-bac students or internship students to help them with their research. And some of that research is clinically oriented, so they might be reaching out to would-be research participants in a clinical context. So that's another sort of way for you to get a sense for that work. But with HIPAA and with, liability kinds of issues, it's hard for you to just shadow somebody. I could never take on a student just to shadow me in my work. Unfortunately, I would never fly, but there are places and situations that involve peer support. For example, there's a group called Alternatives to Suicide that functions much like a 12-step program, but it's for patients, it's for folks who are specifically, had an experience with suicide and maybe as a survivor of suicide, that they can go and participate in a support group. So there are these sort of strange kinds of hybrid-like situations. You can probably find some on social media. I don't know that I would necessarily go in that direction first. That could be a little dubious. But if you have questions, you're welcome to run things by me and I'll give you my opinion for what that's worth. So those are just a few of my thoughts.
There's also a huge need right now for contact tracers, which is a little different than the clinical shadowing that you're referring to, but it is interacting directly with folks who test positive for COVID. So in a sense, patients and their contacts. And I think the need for that as the pandemic hopefully comes back under control with increased vaccination, it's just going to go up. We actually do less contact tracing when things are so widespread as they are now. And as things get hopefully more contained as we move into summer, it's likely there'll be even more demand for contact tracers. And that's a great entry level, either internship or, post-college position.
Also, a lot of community health organizations have volunteer and outreach programs for various avenues, and a lot of hospitals and medical organizations hire scribes. And a scribe is not necessarily a medically trained person, but it really gives you like a very intimate inside view to a medical interaction.
There's actually, right off of Alexis's thought, there are companies now that are developing virtual scribes and virtual scribing programs. I can say that as a clinician, having worked with a scribe, which was wonderful, a scribe is essentially a human to replace our EMR system. Scribes are actually, I say scribing is one of the best ways that anyone could possibly get true clinical experience, in the sense that you see firsthand the decision-making process that goes into a clinical evaluation, and then like a provider's, what we call our assessment and plan for a visit. And scribes are people who are trained to they're not just dictating. I worked with a scribe who actually I could verbalize my assessment and plan, and they would actually help document that. And then, but there are formal organizations that will train people to become virtual scribes and then work with various organizations in their EMR programs or computer systems to, essentially overcome the burden of documentation during the pandemic. So I think, looking into training like that, there are many well-known companies that that do this kind of work, and that would be a great way to get experience. So essentially what that would look like would be like someone else would be on the phone or, in the video session, doing telehealth, and, they would be, working with you and documenting in the record, all along. So that's something that I'm actually pursuing right now to see if I can find a virtual scribe to work with me.
John, did you have some thoughts?
Pre-pandemic, in my field, I had many students at different levels shadow me when I was doing clinical work. I didn't have the HIPAA issues that you deal with, Jonathan, but unfortunately with the now with the pandemic, that's not happening. And as far as the being able to shadow in some of our centers, our wound care centers, like I said, pre-pandemic, I wouldn't be a problem, to be able to shadow. And I think the importance of these internships and being able to shadow is to see what the day-to-day life, a day in the life of a plastic surgeon or an endocrinologist or a wound care specialist, and say, okay, this is something that I'm interested in doing or pursuing. As a sophomore in college, that's really what you're going to get out of that. But again, unfortunately, as of right now, all of that is on hold. We're having a difficult time keeping our centers open because we had to convince these hospitals that wound care was an essential service, and it wasn't easy to do that. So it's not easy to bring anybody in. But I think, and I'm hoping that this is not going to last forever, and God forbid, and that we're going to get back to some form of normalcy and be able to, offer the ability to shadow, whether it be shadowing a clinician, shadowing an administrator, shadowing the CFO, if you're into numbers. In our company, we had a wonderful internship program, but it's all on hold. Right now, everybody's working from home. So we haven't come up with a virtual internship program yet. When we do, Vassar will be the first to hear about it.
Okay. Any other contributions from the panel? Okay. More questions from the students or from the panelists?
I have a question. I mean, it's kind of for everyone. And it is, do you think more people will be interested in going into medicine and health related fields because of COVID or not? I mean, is it something that is inspiring people to be interested, or is it something that folks are like, wow, no, thank you?
Alexis, there was recently, I read that there's a 27%, close to 30% increase in medical school applications because of what's going on.
Fauci.
More people. Yeah, obviously, they're seeing, how important, healthcare is. Getting to Morgan's, Morgan has been telling us, during these conversations how important healthcare is. And I think people are starting to realize, holy cow, it is something that's so important. And as horrible as it was with all the politics behind it, but just the fact that, in such a short period of time, we have 3 vaccines. I mean, and hopefully the tools to get this under control and it's all because of healthcare. We've been able to do all of that. So I think there's a lot of young people that see that and say, hey, this is a way for me to be able to do what I like, and at the same time do something that's going to have an impact on society.
I can say in my hospital, we've lost half a dozen providers. Retirements have been accelerated. People who have seemed like on the edge of burnt out. So it's interesting that so many more people are applying to school and they're interested in coming to the work. And it's almost like the field might be turning over a little bit faster. So I'd be curious to see what that looks like. There's been an explosion of people in my field providing trainings and seminars and workshops online. It's its own whole industry that almost happened overnight. And I can sort of understand its attraction. I also hate doing online trainings. I'd much rather interact with people in the same place if I have that opportunity again in the future, or at least one-to-one or in a small group is generally my preference. But those things are all changing. Those things are happening. So there's, just as we've seen in education, where there's been an explosion of interest in developing pedagogy and curriculum for online education efforts, I think the same thing is happening in mental health domain, of how we can interact with a community or a group of patients in a new and different way. How we can take our in-person groups and put them online. How 12-step groups that used to function in the basement of a church can move to an online platform, and what are the challenges associated with that. In some ways, outreach to homeless patients has become a lot easier because everyone recognizes the need for new technology. So we have greater availability of phones and iPads with, that are enabled to have cheap Wi-Fi, just so that we can stay in touch with them. And there's more funding for that. So these are some interesting things. Like, the VA gave me a laptop, in early April, about a month into the crisis. And that was something that I sort of had to fight for, but it just became apparent that nobody's mission was going to be accomplished and the hospital was going to lose money if we couldn't keep encounters going. I was seeing patients on Zoom, until I was able to gain access to medical records. But, I felt like I had to do what I had to do, which is to make sure the patients needed to be seen were seen. And, I'd worry about the specific documentation concerns later. So those
in my clinic, I was almost furloughed or laid off. We had to cold call patients on our own. We had no support. And, if someone answered, we could have them added on to our schedule simply for the sake of them being billed to keep our health center open. And, the stress and impact of being, in particularly a primary care provider, with a massive panel of patients, I think we romanticize medicine and healthcare, and it's easy to do. But the sad reality of it is a lot of people in healthcare do not want to continue, or I myself wonder how can I continue in a healthcare arena that is often feels like a disease promoting and perpetuating system. When, you know, we should have been teaching people skills like self-management and how to take care of themselves and prevent disease all along. And now people, when someone needs a psychiatrist or psychiatric provider, there's a 6-month waiting list. And, you know, our system is in trouble. So if anything, if people want to go into healthcare, they need to innovate it. That, I think, is the task at hand. Not just the crisis of shortage of providers we will have very soon, but we truly need healthcare innovation. So keep that in mind.
I'm sure Lauren is enjoying what you're saying because she's all about the epidemiology and the prevention.
I'm cheering in the background. And if any of you students are feeling like, wow, the system is really in trouble, public health is really where it's at for that.
Yeah.
Or
See,
be
now
like med and computer science and,
yeah,
you know, like.
I think that, you know, the way the system has developed, our healthcare system in this country, is it's not healthcare, it's sick care. And it would, you know, we are looking to all you young people who have energy and vision and aren't mired in thinking about the system the way it is. And I think to Lauren's point of like, it really needs to be shaken up. And my hope is that this terrible pandemic that has really devastated this country and the world, you know, perhaps this is a time when things have shaken up enough that we will really look at everything, all the systems, and try and figure out how to do it better. Because clearly we are not doing it right. Clearly we are spending so much money on care and not on being well and being healthy. And there should be a focus on, you know, wellness, on health, on improvement, on mental health. You know, there are all these things that aren't paid for. So, you know, I look to you all with fresh energy and brains, and, you know, you don't have, I'm hoping that this is going to be a turning point for the way that health is delivered, because it really is broken. You know, I think we can say that. Which is not to say that you shouldn't go into it, and it's not to say that it's not gratifying, but it's a system that is, you know, super complicated and not focusing on the well-being of all the individuals. But I do think you can make a difference even as an individual. And, you know, there are a lot of things that were super difficult about my training, my career, but I still, you know, I love what I do. I love being a surgeon. I love the opportunities it's afforded me. And would I do it again? I don't know. That's another question.
I was going to ask that to the clinicians on the panel, because, you know, when a few physicians get together, providers in general, they always end up asking each other, would you do it again? And unfortunately, a lot of them will say, no way, never do it again. And it's unfortunate because, you know, getting back to what you're hearing, and this is for the students that are listening to this, you know, yeah, there's definitely a lot of chaos, you know, in the healthcare arena right now. But I forgot exactly who said it, but where there's chaos, there's opportunity, and especially, you know, when you have fresh eyes and a fresh point of view. You know, coming in to this, you know, to healthcare in general, and like Lauren said, from a macro point of view, from a public health point of view, you know, you're going to have an impact. You know, you're going to have an impact because you know, every decision you make will make it less chaotic. So, you know, you'll get that satisfaction almost immediately. You will have an impact. And like I said, there's opportunities out there. You know, there are jobs in the middle of a pandemic. You know, unfortunately, we don't have enough nurses. We don't have enough providers to be able to give the vaccines. So there's always going to be a job, and you can't say that about any other industry.
Something this kind of depressing conversation brings to mind for me is that I had a professor in grad school who said, and I think about this all the time, he said, all of the problems in this field already have solutions. We don't need people to think of solutions. We need people to communicate better about the solutions. And I think that's an oversimplification. This is a really complex field, but I've been thinking about it a lot in COVID over and over again, where, you know, like we want people to get the vaccine and suddenly the vaccine is free to everyone. So we do know how to give out healthcare to everyone. We generally choose not to in this country. And that's just one of a million examples where you see like suddenly it's like, oh, we do know what to do. But I think too, we have a real communication problem in healthcare and in public health both. We've done a not great job communicating as far as public health goes about, you know, what to do, how to prevent getting COVID, like best practices. My family calls me all the time asking me to clarify, do I need 2 masks? Do I need 1 mask? Some people are saying fabric masks are no good. I mean, we haven't communicated to the average person very well. And I think, you know, for the students, I think a really important takeaway for me, and I think Morgan alluded to this earlier too, is learning how to communicate is such a critical skill that you can gain while you're still at Vassar. That is, if you can learn another language, even better. But learning how to write clearly, how to speak clearly, feeling comfortable talking to people about really complicated things in a way that's understandable and relatable to them. I think that's so much of public health, and my sense is that's also a lot of clinical medicine as well, is being able to really meet people where they're at. And you know, I'm doing a lot of this in my day-to-day job right now of talking to people who are hesitant to get the vaccine. And it doesn't work to just say, you should get the vaccine. I've had no success with that, but you have to really meet people where they're at and they have real valid concerns, and still they should get the vaccine. But, you know, needing to hear those concerns and respond to that, I think those are skills that I wish I practiced more in college, and I would really encourage all of you to seek opportunities to have difficult conversations, to learn how to write better, to communicate with people who look different from you or have different experiences from you. Like I said, if you can do so in more than one language, even better. Those are really, really critical skills that we need to transform the system.
You know, one area that I think I'd like to draw an analogy to, perhaps. Turns out the thing that makes a difference for veterans who are at high risk for suicide are identifying actions that they can take that are consistent with their values, where they're adding something to their lives rather than moving away from something that they're struggling with. Rather than subtracting an aversive experience, they're moving in the direction of something they want more of. So it turns out that as more folks engage in their world and develop greater flexibility in their range of behaviors, the healthier they become. And I guess the analogy I'm trying to draw is that these are not just things that benefit our highest risk patients, but they're things that benefit all of us during this time where we're experiencing unprecedented isolation and limitations, where we really have to think about, you know, what's my exercise routine going to be today that's different? You know, how am I going to stimulate my mind so I don't play video games all day? That happens to me. You know, what am I going to do to keep learning and growing? And these are things we start to learn or challenged to do for ourselves. You know, when I went to Vassar, the thing that was hardest for me were during breaks. I would find that towards the end of break, I was dying to get back to school because I didn't have any structure and I didn't know how to create it for myself. I see some nods happening here. Well, that's essentially what we're kind of going through during this COVID, is how do we create enough artificial structure where there's still a sense of meaning and purpose and connection to something we care about. And the one interesting thing about the VA, one of our greatest undertapped resources are the veterans themselves. We have tremendous underemployment in our veteran population, but we don't actually ask the veterans who have been successful how they can mentor and connect with other veterans. There are groups and studies and places where this is happening, but it's not happening as a system, as a matter of planning at the VA, at least at my VA, and I'm not aware of anything like this. This is an idea I've tried to promote in various different ways. Every time, this is my sort of elevator's pitch if I ever get in front of somebody important, that, you know, there could be a vision here. But the neat thing about this forum is that Vassar is making use of its alumni to have these conversations, and not just here's how you get a job or here's what the profession looks like, but, you know, here's how to broadly think about what's important to you and how to identify steps in a direction that will add to your sense of growth and your sense of connection and your you know, opportunities to develop community with folks you want to be connected to. So this is a reason why I enjoy doing community connections, even if it's only through a screen. I feel very connected to the panelists today who have devoted their time and their energy to wanting to talk about, you know, their unique vantage point and sharing it with folks who, you know, who might find something in this that, you know, that can help them.